Your Excellency Minister Budi Sadikin, Minister for Health of the Republic of Indonesia, Your Excellency Mr. Suryo Pratomo, Ambassador of the Republic of Indonesia to the Republic of Singapore, Mr. Wilson Chuacha, Co-founder and Managing Partner at East Ventures, distinguished guests, ladies and gentlemen, a very good day to all of us. Welcome to the Embassy of the Republic of Indonesia in Singapore. Allow me to first introduce myself. I'm Juriani of the Embassy of Indonesia, and it's an honor to be your MC today. On behalf of the Embassy, I would like to welcome all of you to the Fireside Chat with Minister for Health of the Republic of Indonesia, jointly organized by the Embassy and also East Ventures. As you may all know, East Venture is a pioneering and leading sector-agnostic and Indonesia-focused venture capital firm. Founded in 2009, East Venture is now a holistic platform that provides multi-stage investment, including seed and growth for over 250 companies in Southeast Asia and Japan. Without further ado, ladies and gentlemen, may I have the honor to invite Your Excellency Ambassador Suryo Pratomo to deliver his remarks.
Your Excellency, Minister Budi Sadikin, Minister of Health of the Republic of Indonesia, Wilson Chuacha, Co-founder and Managing Partner at East Ventures, all our friends, welcome to Nusantara Room, Indonesian Embassy. We call it Nusantara because we put all the batik pattern all over Indonesia around this building. It's very glad, it's an honor to have Minister Budi Sadikin with us in this afternoon. It is also a very privilege. We have Minister Budi Sadikin twice within a month. Thank you, Pak Budi. And at the outset, I would like also inform you, Pak, joining us in this afternoon is Singapore health sectors, private players, Indonesian businesses, and also Indonesian diaspora in Singapore. So thank you so much also to Wilson Chuacha, have arranged this gathering. Wilson is always collaborate with the Indonesian Embassy since we have the challenges of COVID-19 pandemic. Wilson and the Embassy is working hard to find the oxygen concentrator. Even finally, we decided to change, become oxygen generator, and we are, and also with East Ventures, I think we have more than 20 oxygen generator now have already put all in the local hospital around Sumatra. I would also like to extend my appreciation to all distinguished guests here. Your participation shows strong support to our both countries to expand more cooperation opportunities, particularly in the health sector. I'm glad that we will have a discussion on this very important issue on Indonesia health sector, a topic of such pressing concern. As public health is a critical pillar of the economy, primary health care is a cornerstone in achieving national health coverage. Healthcare that focusing on promoting health and preventing diseases as well as treating it. Healthcare that empower people to become active participants in their own health instead of passive recipient. COVID-19 has revealed how vulnerable the healthcare industry is to change and its need to structural and technological transformation. The demand for health services is expected to grow in tandem with increasing emphasis on proactive, preventive, and not just reactive healthcare. Healthcare, as we know, is today may no longer exist there will be a fundamental shift from healthcare to health. And while disease will never be completely eliminated, through science, data, and technology, we will be able to identify it earlier, intervene proactively, and better understand its progression to help consumers more effectively and actively sustain their well-being. In the future of health, we expect 6 areas: data sharing, interoperability, equitable access, empower consumers, behavior change, and scientific breakthrough to collectively transform the existing health system from treatment-based reactionary care to prevention and well-being. I believe that Indonesia is well positioned to capture opportunities from this new healthcare trend. Healthcare is a growth sector for Indonesia, and Indonesia is home to a dynamic and growing ecosystem of leading digital companies. Moreover, our Ministry of Health, along with its 6 pillars of healthcare reform, is now turning to digital solutions with the overall aim of boosting service capacity in primary care, improving access and quality of secondary and tertiary care, and building human resources capabilities, among others. Distinguished guests, ladies and gentlemen, in 2022 and the near future, health is and will remain a priority for Indonesia. During its G20 presidency this year, Indonesia focused on the strengthening of the global health architectures, among other things. As for other countries, completing the current recovery and investing in the resilience of global health infrastructure are crucial for Indonesia. Doing so will set the national economy on the path toward more enduring growth and prosperity, and will have us better prepared for the next health shock. More importantly, we need to ensure the availability of financing to do it all. Indonesian government views that partnering with industry and other stakeholders in the healthcare is a must to seize opportunities from new business model, development, testing, and export of new healthcare solutions. In this regard, Indonesia looks forward to gaining interest from Singaporean private sector players in health sector to become strategic partner with, among others, healthcare provider, insurers, and health startup in Indonesia. Hence, Your Excellency, we are all very pleased to have you here. Thank you once again for sharing your experience and expertise with us. I firmly hope that our discussion today will bring us together to identify more concrete effort to maximize Indonesia's potential in health sectors. I thank you.
Thank you for your remarks, Your Excellency. May I now invite His Excellency Minister Budi Sadikin and Mr. Wilson Chuacha to be present at the stage as we are about to start the discussion, which will be moderated by Mr. Wilson Chuacha.
Ada materi yang bisa ditampilkan. So, ladies and gentlemen, I'm a nuclear physicist, become banker for 30 years, and then become Minister of Health in 1 year and 9 months. But what is the most difficult and the most pressured job is 1 year and 9 months. It feels that I've been working for 19 years already. When I joined in December 2020, so I only have 3 years and 9 months to finish my job. And I asking Pak Jokowi, Pak Jokowi, what is your target? And he said, would you just do the vaccination as quickly as possible? Which is not bad. We did 440 million doses to 205 million Indonesians in 15 months, 1 year and 3 months, which is not bad. And then his second job is, please control this pandemic, because otherwise our economy cannot move back again. And it's not bad also. Today, our average daily cases is 2,000, still a little bit lower than Singapore, 6,000. We just got the new XBB variant, but hopefully it is under control because Indonesians are more disciplined in wearing masks. And so far, because the timing is just right, so the antibodies level is very, very high because we did a sero survey every 6 months to measure the level of antibodies around systems and in 34 provinces. And it's become very high, 50% because vaccination from Pak Jokowi, and 50% because vaccination from God. You got infections and you got the antibodies. And based on the research, combination between infection and vaccination deliver the best the best protections to our people. But the third job is the most difficult thing. Budi, why don't you do the biggest ever reform in Indonesian national healthcare system? Okay. I said, why me? Oh, because I saw your track record. You have been, the CEO of the biggest bank in Indonesia, and you have seen all major financial crises. Since 1998, 2008, major financial crises, you are in the middle of it. So you know exactly what we did wrong, what we did right, what are the right policy, what are the wrong policies. And the president said, which I still remember, hey, if you trace the history of Indonesia during crises, we always do a very successful reform. So for me, 1998 is the biggest financial crisis happened, and that is the biggest reform in Indonesian banking systems. That is also the biggest reform where the central bank is taken out of the government and stay independent. It is also the biggest political reform in the country, but Tommy knows that properly. So he said, so let's do a major reform. And then I remember when I was a banker, young banker in 1998 during a crisis, every time I met with Western banker, European or American, they said, Budi, yes, banker, you know this? You have nothing left on your right side of the balance sheet and you have nothing right on your left side of the balance sheet. It took me 30 seconds to understand. What does it mean? But when I met with a Chinese Asian banker, they said, Budi, we see things differently from the IMF. In Chinese, crisis means Wei Qi, two Chinese characters. The first character, Wei, can be paired to another character, Wei Shen, which is danger. But Qi can be paired with another character, Qi Hui means opportunity. So the Asian bankers said, different with the West. Every crisis, there is a danger component, but also the opportunity component. And you have to be careful which way you look at that, which angle you want to see. Now I would like to see from the opportunity angle. Next slide. I will do this. This is given away. So we have defined 6 major reforms that we'd like to do. First is reform in the primary care, closest to my heart, to make people healthy, not to cure sick people. Second reform is secondary care, which is the hospitals. Third reform in health system resiliency. So in the next pandemic, we are ready. Fourth reform in healthcare financing. Fifth reform in healthcare human resources. And the sixth reform in healthcare technology, information technology, and biotechnology. This is what we're going to do in healthcare. As a banker, I realized the number of accounts in 270 million Indonesian is only 60 million when I retired as a CEO of the biggest bank. I said, how come only 60 million Indonesians have bank accounts compared to Indonesians that smoke? 100 million Indonesians smoke. Smoking inclusion is much better than financial inclusion. The reason why we don't have enough outlet. Banks only have like 40,000, 50,000 branches. If I give loan to Gudang Garam, to Jarum, to Indofood, to Unilever, you at least need the 300,000 to have the proper outreach to sell your product to 270 million Indonesians in 7,000 inhabited island. So even you put an angel, they will never be able, to sell all these banking products if you only have 60,000 outlets. So that's why when I came as a health minister, that numbers is clocking in my head. I need at least 300,000 to deliver healthcare services to our clients. And Indonesia at that time only have 10,000 puskesmas, primary care. But somehow, in Indonesia, somebody very, very smart during Suharto time built what is called posyandu at every villages. And they have exactly 300,000. So that is not my idea. The only thing that I changed, posyandu before is very concentrated to take care of babies and mother, because our population at that time is young. Now what we did, we revitalized. We standardized the services, all life cycle, babies, children, adult, father and mother and elderly. And then we put digitalization standard and increased the services, more promotive and prevention. 14 screening, 14 immunizations, consultations, everything put on that one. We also established the labs. Before we don't have public healthcare labs. During COVID, we had a problem we realized we don't have enough PCR lab. And suddenly, because of COVID, now we have more than 1,000 PCR lab across the country. Now we will make sure that all 515 cities have a PCR lab, BSL2, and at the provinces, regional level, 34 provinces will have a genome sequencing lab. So we structure also and formalize the labs. This is the major reform on the primary care. And we will provide with equipment, we will provide with human resources, and also digitalize everything, so everything can be done. And this is some of the programs. All of them are more of preventive actions, preventive action related with the top major diseases that we have. So what is opportunity for you? For example, definitely we'll do the diabetes or glucose test. More than 100 million of Indonesians, linked to a Bluetooth device and linked to the handphone, and we can geotagging to Google and we can understand the populations, which one have diabetes or not. So when we want to do intervention, it is based on real data. The same thing for hypertension, the same thing for cholesterol. Because the major diseases that kill Indonesians first is heart attack, number 2 is stroke, number 3 cancer, and number 4 is kidney related problems. Now, what are you going to do in the secondary care? This is a very sad story. Next slide. These are the major killers. Heart, cancer, stroke, kidney failure. Not only in terms of cost of life, but cost of money. Because heart failure costs 9 trillion rupiah every year for our national resources. And you might be very, very surprised. Maybe you're not surprised, because if you want to have a heart attack, you need to put the ring inside. You're very lucky if you can get it in 3 months, because the queue is very long. So we have a definitely supply side issue. And not only all 514 cities have this facility, even only 28 provinces have this facility. Bangka Belitung, West Sulawesi, Maluku Utara, Maluku, Papua, Barat Papua, they don't have this facility to insert the ring. So if you are unlucky and got heart attack in Ambon, what you can only do is to pray. So the doctor fly you to Makassar and Manado or Surabaya and you still live to be inserted by the ring. Because we don't have that facility. Yeah, so we'll complete everything. My target by 2024, all provinces 34 and half of the cities 207 will have a standard treatment for cancer, stroke, heart, and kidney. And we have calculated numbers on all the devices. So that will be a major investment for health devices. The cancer is definitely the most expensive one. But money has never been an issue. We have enough budget to do it. Yeah? The problem that we have, we don't have enough people to do it. Yeah? Now the health system resilience, the third reform. Okay, hopefully it works. Next slide. This is basically, if there is another pandemic, we will survive the lockdown. So my target is 50% of emergency health countermeasure, vaccine, therapeutic, diagnostic, can be produced and built in the country. not because of anything else, but for national health system resiliency. So vaccine company, biotech companies, mask, ventilator, instrument, we will bring them to be in the country. Otherwise, we will not buy. The government will not buy. And we have a timeline. What drugs, what medical devices, and what vaccine that we would like to develop. On top of that, we will build and establish a health reserve army. Singapore is very famous. We have a reserve army. Indonesia, we don't need a reserve army because it's very small chance somebody will attack us. Too difficult, Indonesia, too many people. Ukraine itself is so difficult already. Can you imagine you want to invade and occupy Indonesia? Extremely difficult. Even the Indonesian as a leader, it will be difficult to manage our people. So how are you from outside can manage our people? The Indonesian people is such a difficult people to manage, right? So what I would like to do is, we need to prepare the health army, reserve army. And to be cheap, I would like to use the students of the health nurses or doctors and also Boy Scouts. I just realized Indonesia has 25 million Boy Scouts. So it's cheap to build the health army, how to do testing, tracing, small vaccination, etc. Because during the crisis, we realized we don't have enough people. So this is what we are going to do for the future. Health financing is my good story for all of you. We have 4 big investors sitting in front row. Can you go to the next slide? That's not working. Next slide. Oh. Okay, it is, for me, health sector is a big problem because health cost per capita always increase in most countries for the last 20 years bigger than GDP per capita. So it's like you are married, you have a wife, your salary increase in Singapore only 5% every year, and your Indonesian wife asks for allocation increase 15% a year. Although it's smaller, it's unsustainable. Either you got divorced or you move to another job that can give 15% increase. So that happened in health sector. This chart is by Michael Porter 1 month after I became the health minister, which is very funny. But what I would like to share with you is not here, but next slide, is that the opportunity is so big for the 4 guys sitting there. Indonesia health cost per capita is $112 per annum. 72 years life expectancy. Malaysia, $432 per capita per annum, 76 years life expectancy. Singapore, 2,680 for 84 years life expectancy. So if in the next 5 years, Indonesian population are aging, and the average life of Indonesian reach Malaysia level, 76, and we have as efficient as Malaysia our healthcare system, then our health cost per capita will increase from 112 to 430, which is $300. Multiplied by 270 million, $81 billion. Now depends on which angle you want to see. From Ministry of Finance of Indonesia, there is a nightmare, 81 billion additional costs. But for investor or startup company, that is a great opportunities. 81 billion revenue upside. If you go to Singapore level, 84 years old in the next 10 years, goes from 112 to 2,600, $2,500 increase. You are talking about $500 billion upside. 50% of Indonesian current GDP. If you talk to Ministry of Finance, there is a nightmare for Indonesian next Minister of Finance because they have to think how can he carry 500 billion additional health costs. Yeah? So that is it. We are lack of doctors. So you want to get a job as a doctor, you go to Indonesia. Specialists especially. Yeah? Because Indonesia only have 0.4 for 100,000. Put it this way, WHO said developing country 1 doctors per 1,000. Developed country 2 or 3. I don't know about Singapore. Indonesia, we only have 270 million, so we need 270,000 doctors, right? I'm a banker, so I'm good in numbers. especially if simple, multiply, divide, plus and minus. I can do it easily. 270,000 doctors, existing 120. So we need 150,000 gap. Our annual production, 12,000. So we need 15 years to catch up. I look back 5 years ago, the same. 10 years ago, the same. So these doctors are very smarter than Indonesian economists. They understand the pricing elasticity model. When demand is much higher than supply, then price increase. So that's why now I give 1,500 scholarship. Before it's only 200 to 300. I talked to Ibu Sri Mulyani, get 1,500 every year scholarship for specialists and doctors. So it will be paid by government to increase the number of people. I open up the university. Only 92 university can train doctors, and only 20 university out of the 92 can train specialist doctors. So we will open it up. We will bring easier doctor coming from outside, including foreign doctors. We would like to standardize all data in hospitals, clinic, pharmacies, labs. By December 2023, they all have to be digitalized and linked to the national database system. And we are not progressing. Every month we review. So next time you go to labs, check your blood sample. The next day the data will appear on your Peduli Lindungi, on your citizen health apps. And then 1 week after that, you do medical checkup in Rumah Sakit Pondok Indah. Your CTI, your ultrasound, everything will appear also in your citizen health app. And it's owned by you. You go to pharmacies, it will appear also on your citizen health app. You can link with your Apple Health or Samsung Health or whatever it is, and it will be owned by you. So you have historical data of you. Next time you go to see a doctor, you can pass this data to your doctor with your permission. So it will be easier for the doctors to learn. And if you put a tick mark, passively you said that I don't want this to be taken by the government. If you forgot to put the tick mark, then this data will be put in the government database without your names, and we can use artificial intelligence and machine learning to study 600,000 stroke incident every year. Genetics, blood samples, everything. 700,000 heart attack every year. And with this artificial intelligence and machine learning, that will be ample of data that you can do a better diagnostic and therapeutics. Yeah? Last one is biotechnology. We understand this is the future of medicine. Next slide. That's all right. We established this initiative 17th of August this year, where 6 hospitals, national reference hospital for cancer, diabetes, infectious disease, neuro, rare disease, and beauty and wellness, we put a genome sequence machines, and they will start doing the job to sequence the sick people. My target is 10,000 sick people by the end of 2024. So we will have the clinical data, we will have the genome sequencing data, and we will match this data with a certain bioinformatics platform to understand what are the precise pharmacy that we have to procure. What are the best diagnostic that we should do? And because we have a lot of populations, including sick population, that will be a very valuable data to move forward. Yeah? The future of medicine will be very, very precise. Before the doctors, take a look at your mouth, open your mouth, push your chest and say, oh, you have a heart problem. That is 100 years ago. Now, 50 years ago, the doctor asks you to take your blood sample, check your LDL, cholesterol level, and said, oh, you have a heart problem. 25 years ago, they said, okay, why don't we do CT scan? 500 slices, 138 slices, you have a heart problem. In the future, everything will be done by genome sequencing tests. Like when Angelina Jolie went to Mayo Clinic and do the genome sequencing test, and you will have a breast cancer. Definitely, 95% probability because your genetics are like this. So would you like to take the risk, or you would like your breast to be taken out now? And you know what decisions you make. This is the platform that we are preparing, bioinformatics. especially the tertiary analysis is very, very important, and it needs large enough clinical data. And Indonesia have clinical data. Singapore is too healthy. So it's very difficult to find 1 million breast cancer patients. Indonesia, we have a lot. So we can understand that and live. And I know that is where the money is. The multiples you can make through that. So that's why we would like to control that data. Next slide. Now, this is what we're going to do, and I strongly believe that Indonesia should be healthier if we would like to be a great country in the future. And we just have to improve our national healthcare systems. So my target, if by 2024 I can implement 50%, 75% of this, hopefully we can leave something, a better world for our children and the children of our children. Thank you.
We have about 15 minutes for the Q&A before heading for lunch. Yeah, please. Your name, your company, institution, your occupation. Yeah.
Sure. Thank you, and thank you so much for the very enlightening presentation. My name is Ovi Wijayanti. I currently work here at the Joint Commission International. It's a US-based company focusing on healthcare quality and patient safety. And I'm currently overseeing a partnership between my company with the Singapore Ministry of Health in the field of quality and patient safety. And I'm very interested with one part of the presentation that talked about standardizing the treatment for the 4 major killers and then having major healthcare center in each of the 34 provinces. And I'm wondering, because part of my work always deals with the notion that access to healthcare is important, but it's not enough. We need to give people access to a healthcare that's also safe and of high quality. And I know that in Singapore, in Malaysia, the government has started this partnership with international companies in this field to try and improve also the quality and safety of their public healthcare setting. So I'm wondering if there is any plan forward for the strategic partnership with global players in this field of quality and safety that will be used alongside with developing the new major healthcare centers that you have in the strategic roadmap.
So we plan to implement a large amount of new devices related with heart, which is cath labs basically, and stroke. We need also a cath lab, and also cancer, PET scan, LINAC, you know, whatever the name it is. I'm not a medical doctor, but you are right. For me, what important is access first, because now heart is the best example, the most prepared. If you move down into stroke, and stroke you need to do it very, very quickly, right? If you have stroke, the number of hospitals that have CT scan is maybe 3,000, maybe you have 700, 800, we have CT scan facility. So can you imagine, you don't know whether it's hemorrhagic or ischemic stroke, right? And you can give a wrong treatment. So for me, I will open up the access quickly. Hopefully by 2024, more than 50% is done. And my second issue is the people, because we don't have any more specialists, neurointerventionists, heart interventionists, that is. So the quality, to be honest, is my third priority. Because it's not that it is not important, but sometimes we don't have the device. We don't have the people. So I don't mind to get, Budi, you need to have the University of Indonesia doctors, you get the first quality, to all the 515 cities. Oh, forget it. Even now, it's only 100 have this kind of thing. So I will get the access first, device and people, and then move to quality. But of course, I would like to get it as quickly as possible.
Thank you, Pak. Any other question?
Hello, Minister. Oh, sorry. My name is Piotr Jakubowski. I am a result of the Indonesian healthcare system because I was born in Rumah Sakit Pondok Indah. I'm the co-founder of Nafas Indonesia. We are building an air quality health ecosystem that uses data to provide transparent information to change behavior and drive healthier lives. We recently studied the impact of PM 2.5 on consultations based on ICD-10 codes specifically for air pollution-related diseases. We saw a 40% increase in issues as soon as PM 2.5 levels increased by 10 micrograms per cubic meter. We're going to be publishing this study soon. Air pollution is a global problem, and the air that we breathe is the one key shared resource that we have, regardless of whether you're living in Pondok Indah or Cilincing. We're actually all sharing the air that we breathe right here. How does the Ministry of Health plan to address the air pollution as a health issue? And how can the private sector like us help prevent disease, change habits, and make people in Indonesia healthier?
Number one sickness that is not killers. Indonesia is respiratory related. Respiratory related. And I have to admit, when I arrive in Singapore, I can feel the difference between the air in Singapore and air in Jakarta. But I know also when you are born in Pondok Indah, then your income level is slightly above average of any Indonesian people. So as a banker, I recognize that. For us, prevention is a key because it's much cheaper and better quality of life. So if we can show that not only measuring the data, but what can we do or what will be the impact if it reaches a certain level, and what can we do to show to the politicians to reduce this level, that will be wonderful. Because so far I have the apps that show the quality of air, but I don't know whether this apps is credible or not. Yeah? And if we can link this app to number of incidents after this satu data, the database is integrated, every time you hospital register a certain ICD-10 or ICD-9 code related with respiratory, then we understand. And then we can geotagging to Google and say, hey, suddenly Pondok Indah, many people have respiratory problem because they come to the hospital and these are the codes. Then we can do intervention specific to a certain area. That is the intention. Because rather than wait you to get sick, it's better to monitor the condition when you are healthy. So I'm looking forward. I'm very looking forward, especially for preventive and promotive.
Thank you, Pak. Any other questions? So I know Pak Budi since like 10 years ago, and he's one of the person that every time I talk to him from finance, now he can talk all the medical lingo that is like so complicated, but he can pick it up so fast. Yeah.
Hello, my name is Levi. Pak Budi, I have a question for you. As a co-founder in a startup, how does a startup partner with the Ministry of Health in Indonesia, either to access data or collaborate in co-development or even clinical trials? Is there like a system to engage? And the second part is that I'm already thinking the 2 years, how we're gonna miss you a lot as the minister. And so we're thinking about, a lot of us are, maybe like the chats are thinking about what are the sustainability of these policies, especially for us, it's the genome sequencing project that we absolutely love and want to see succeed. What are some of the sustainability issues and interventions that you're creating today? Thank you so much.
The second question, sir.
Yes, actually the question I want to ask the last part, but now she took it.
You saw the newspaper about the UK prime ministers, right? Sometimes, to be honest, I'm not a politician, but I see many people said, and this is my personal opinion. Many people said democracy is the best system in the world. To be honest, if you compare Indonesia and Singapore, Singapore is way much more advanced than Indonesia. And they are less democratic. You agree, right? The same thing with China. So my personal opinion, sometimes when you choose leaders based on popularity or Instagram quotes or Twitter calculation, that can be really, really wrong. When I met with my colleague, Lawrence Wong, I knew Lawrence when he was the finance minister. I want to see this crazy, health minister because he's an ex-finance people. You can see the difference between a democratic and non-democratic process. As long as it's good. The same thing happened in China also. They are definitely not democratic, but at least it's tested as a leader. They move into several positions before they move forward. But anyway, that is my personal opinion. So that is the risk. And you as a businessman, me as a banker, we calculate risk. But you have a high risk in Indonesia. But don't forget, high risk always mean higher margin, right? Higher risk always mean higher margin. And it depends, people like you, based on your experience, ask Wilson. Wilson know exactly, he has a very good nose. What are the person that I know that have a very good nose? When Wilson invests in something, without, I don't need risk manager, just follow Wilson. Wilson put 100,000 as equity, we put 500,000 as loan. Close your eyes, just approve. That is the way. That is the risk management. You have to use judgment sometimes. So use your judgment. And God will give you, by experience, how to make it. You will make one or two mistakes. As a banker, I got also ketipu. What is ketipu? I get fooled around by my clients, but after 1 and 2, then you know exactly what you're going to deal with the guy. First question. We have this initiative, BGSI. And this initiative is the catalyst of biotechnology startup in the country. I'm building it. I came to Broad Institute, and there's an institute in Boston that established this one. I deal with Sherry Nursalim, that's very close to Philip Yeo. And Philip Yeo, what I heard, is the one that built the biopolis in Singapore. Now, we would like to do in Kura, Bali, and Denpasar. So I will meet Philip Yeo. These are the great people that establish a successful biotechnology startup ecosystem. So that is the reason why I'm sitting here, actually, because I came with Wilson. For you that understand me, I'm a banker for 30 years. I involved heavily in the establishment of the unicorn information technology startup. I realized the power of the capital, equity capital, to accelerate the development. That is the reason why do you think the health minister is sitting here with him? Because I know him since we were, Wilson, if you can repeat your success, making multiples, not only in information technology business startup, but also in biotech startup, not only on the West Coast, Californian belt, but also East Coast, Boston, Massachusetts belt, I think that will be great for Indonesia. We have a very rich diversity and genomic variety, that is where the multiple can be made. That is where the multiple can be made. Because when you link this data into clinical data, no other country have the diversity and the population numbers that justify any biotech startup for their multiples. I understand clearly. And I understand also that we need regulatory support. So what I'll do, which I already did, I see Singapore biotech regulation, Malaysia, US, Europe, Japan, China. I take a look, which one the safest, and where is Singapore? And I put my regulation one step, not one notch below. Because we want to leapfrog, right? If in Singapore you want to do clinical trial, it's so difficult, I have to make it less difficult. If the tax system is so difficult, I have to make it difficult. If data secrecy in Singapore is like this, I need to do it like this. Yeah? Otherwise, we cannot leapfrog. And then after that, gradually we catch up in the next 5 to 10 years. But we bring the initiative, regulatory initiative, back to the country.
Thank you, Pak. Probably one last question before we heading for lunch. Oh, 2? Okay. Oh.
Your Excellency, Mr. Budi and Bob Wilson, thank you very much. My name is Henry Sudiarko, working for Mill Trust International Group. I just have one question, and it could be a little complicated. Noting the big budget that you estimated, right, and the need for accessible healthcare in Indonesia, how do you balance between the two to create affordable and reachable healthcare access, and where do you source the solution? Noting that this is the question for both of you. Thank you.
So I give an example. US, health cost per capita is 10,000 plus, and the average life is 79 years old. If you compare to Japan, 84 years old, and Singapore, and they only spend 4,680. per capita. 40% of US costs. So I talked to my colleague, Secretary of Health in US. Why you spend so much money and your lifetime is very short? Are you spend so much money for your health or your life? Or you spend so much money to pay your pharmacists, your doctors, your hospitals, right? They're not efficient. And jokingly, I take a look, Google, which other country have 79 years average life? Cuba. And their health cost per capita is only 1,900. So you can see cost in health is very intransparent. This is a bloody intransparent industry. If you constructions, you want to build per square meter cost of marble or for teak wood or for ceramics, you know exactly what it costs. In health, it's very intransparent. Can be here 3 times more expensive or 5 times more expensive, you don't know. So that is the inefficiency in the system. My advice, or what I will do, I will make it transparent. We will start the national health account next year. So every detailed treatment, we know exactly and we can compare. Like you have a chart of account and in banking, you have to submit your report to MAS. You can easily compare bank by banks, fund by funds, because it's transparency is there. This is something that I will do. I will push transparency. It will reduce the cost. Second, health cost is cheap when you do more prevention. Why Singapore have 84 years old life expectancy with only 2,680 US dollar cost per capita per annum? Because Singapore government is brutally efficient. If your waist is above 90 centimeters, what I heard in high school, they will force you to run. Otherwise, you will not get a good score. You cannot pass. Why? It's the very brutal force to make you healthy. When you are healthy, you're productive. When you're productive, the cost of health is reduced. So that is what I'm doing too. Maybe I cannot force Indonesian. Indonesian is much more brutal to push me back rather than Singaporean. You know, Singaporean is much more adherence to the regulations. But at least I can force them or scare them. Hey, if you do this, you will die. Everybody, they're afraid to die, right? To be honest. So if you do this, you will die. So you don't to die, and then you do this. So that is something that I have to.
Probably the last one, the ladies.
Hi, good afternoon. Thank you, Pak Budi, for the questions. Yeah, my name is Savetta. I'm from Thermo Fisher Scientific. So I would really like to ask that for BGSI, I see the slide of collaboration with multiple stakeholders. Do you have a timeline for that, in terms of the collaboration that is coming up? That's my first question. Then my second question would be, do you have a timeline for precision medicine to take place in Indonesia? Last but not least, for oncology, which is cancer, what is the priority for that?
Okay, timeline. Promethean machine from Oxford Nanopore has already been installed and already running. Illumina, what is above Nexic? What is the biggest Illumina machines? Above Nexic. There's the biggest Illumina machine is already there and running. BGI T7 is already there and running. Talk about timeline, only Thermo Fisher I don't have. Only Thermo Fisher I don't have. So hopefully you understand the timeline, you are a little bit behind. You have to run faster. Yeah? And then about the sequencing. What is the timeline of sequencing? Different with other countries that start with population genomics. I can take a look at Singaporean population genomics because it's very close to me. But the real value is on the clinical data. So instead of giving it to the researcher, I'm giving it to the hospitals. The National Cancer Hospital owned by me. The National Brain and Neuro Hospital owned by me. So I asked them, why don't you sequence all of your data? So I will have a lot of clinical data. Then I can link to genomic data easily with the bioinformatics platform that I use. And hopefully by 2034, 10,000 minimum of cancer, stroke, diabetes, tuberculosis, and beauty and wellness. bold. If you don't want to be bold, you can do something and then a lot of hair, or you want to be bulky or chubby, then you can do some gene editing and CRISPR to cut your gene and then make you slimmer again. So we also have a plan to do it. But in 2024, 10,000 clinical data for sick people. And your last question is about
oncology.
Oncology. The death in Indonesia, women, breast cancer, number 1. Number 2 is cervix cancer. For men, number 1 is colorectal. Number 2 is related with respiratory. So if you ask me, I'm a very focused person. I will do those 4 first. I will do those 4 first. Okay.
Thank you, everyone. Thank you, Pak Budi, for your time and your explanation. I think that's all for today, and thank you again for coming to Singapore.
Because there is some non-Indonesian here and some investor. Yeah. Yes, Indonesia is in turbulence and we have a crisis, but remember that. So the Chinese mentioned Weiqi and Weiqians. But I see the European Sea, only through great earthquakes, lofty mountain rises. That is the phrase, right? Only through great crisis, great opportunity comes. So when you have money and you want to invest or you want to work, this is actually the best time to come in. As a banker that have seen many several crises. Yeah. This is one of the best time. You go into health, you go into biotechnology, because I mentioned before, I've been working for bankers for 30 years. 2 weeks ago, Pak Tommy, during a Temasek meeting, I met again with my competitors, Piyush Gupta for DBS. Piyush, what are you doing? You're still CEO of DBS. Budi, why you move to government? The salary is very low. Piyush, I said, I raised 18 billion for global fund. Piyush, it's very small. You have raised trillion, I have raised trillions. We have very small fundraising, but feel very good for humanity. We are raising trillion as a banker, so big, but feel very small contribution to humanity. So I can share with you, Piyush, that the best wealth is health. So why don't you start thinking to switch jobs, or for the investors, start thinking to switch investment into biotechnology. Thank you.
Ladies and gentlemen, thank you, Pak Budi. That's the beauty of having banker as a health minister. We can connect the lingo. Thank you, Pak.